Welcome to Atrium Health Navicent Knows Health. I'm Cindy Busby and I'm here today with Dr. Beth Wright. She's board certified in anatomical and clinical pathology, and today she's going to talk to us about her role as a pathologist in medicine. Dr. Wright, thanks so much for being with me.
Thank you, Cindy.
Would you tell our audience a little bit about what is pathology?
Certainly. Pathology is not a specialty of medicine that a lot of people know about because you think about your exposure to pediatrics and to primary care and internal medicine and things like that, but unless you've actually had a run-in with pathology as personally as a patient, you don't really think about it unless you think of forensic pathology, which is very popular nowadays with the TV shows like CSI and Criminal Minds, et cetera, et cetera. But forensic pathology is a specialty of pathology, but only a very small branch of it. Most of us actually take care of live patients. And our job is, I always analogize it to a radiologist. A radiologist takes pictures of your bones and your organs and looks at pictures. We actually take pieces of tissue, like your doctor may take a skin biopsy or a biopsy of a lung mass or a biopsy of a colon polyp. And we look at that biopsy on a microscopic slide under the microscope and determine what is it, how bad it may be, hopefully not bad, but if that is the case, is it cancer or not? That's one of our main jobs. How extensive is it? What kind of treatment may result from the diagnosis that we make? And we go back and tell the doctor, are you going to need more surgery? Are you finished? What kind of chemotherapy you might need down the road based on the diagnosis. So mostly we are consultants to surgeons, to cancer doctors, and to doctors. We return information to your doctor to then return to you to plan for your care. Unfortunately, most of what we do is not cancer, but that's always the underlying concern, is making sure that we make the right diagnosis for the right treatment and to keep you healthy and make the right decisions for your next step.
So when it comes to getting those samples, people probably think, well, I've had blood drawn and I might have had a mass removed, but tell us how those samples are coming to you and are preserved or processed in a way that you can examine them.
So if you have blood drawn at your doctor's office or any other sample like that, it comes to the laboratory at the hospital, and we have machines that everything's now pretty much automated, in which they test what your cells look like, how many red blood cells you have, or other cells in your bloodstream, the chemistries of your blood, and make sure your electrolytes and everything are okay. We, as doctors, oversee that process. We make sure that the machines are doing it accurately, and that there is a certain level of quality that we have to maintain. And we check the machines constantly to make sure that they are producing the right, accurate results. We do look at blood under the microscope because if there's concern for anemia, for instance, we can look at the type of blood cells that are under the microscope and determine if there's some abnormalities there, or if you don't have enough of a certain cell or too much of a cell. So we do look at your blood under the microscope. We oversee the blood bank and making sure that the blood is properly acquired and adequately stocked, and that you get the right blood for your right blood type. We oversee toxicology, so testing for drugs, make sure your levels are right, as well as drugs of abuse. And microbiology for cultures. If you have a wound or pneumonia or any kind of infection, that would be where that would be taken care of. But as far as, let's say you had a biopsy, a breast biopsy, for instance, or a colon polyp removed or something like that, that comes to a separate part of the lab called the anatomic pathology lab. And those specimens are carefully examined, described, measured. If there are margins, meaning is there a area in which you want to have negative tissue around a tumor and you want to be sure it's completely out, we assess for that. We may do it immediately in the setting of frozen section in which the patient is actually in the operating room and the doctor is waiting on an emergent call in order to make the next decision for that surgery. We can do that immediately and make a slide and look at a portion of the tumor under the microscope and make a diagnosis that way and proceed with the surgery with that result. Or most of the time we do it overnight, in which we take little pieces of tissue and put them for processing overnight and then make slides out of them, and then we generate a report that will go back to the doctor.
Is it still something traditionally where you're looking through microscope, you're consulting either with other pathologists or books? I mean, they used to be books.
Oh,
I guess I've seen lots of books in the pathology lab.
Yes.
Is it still like that, or
Yes.
is there a different technology differential that's now happening? I mean, have we moved into not automated, but more of a knowledge transfer that's different, like maybe through the computer or not as many books like we used to see?
Definitely. So there are 5 of us here, for instance, at this hospital, and that's a good-sized pathology group. And we're very fortunate to have 4 other people with different specialties and qualifications that can bring together a lot of knowledge into one space. So, for instance, my specialty is tumor pathology with an emphasis on breast and pediatrics and soft tissue. Somebody else may be into urology, somebody else may be into bone marrow and lymph nodes. It is almost impossible for one person to be an expert in every organ system because pathology is prenatal to geriatric.
Wow.
So we have to know diseases that affect the fetus into geriatric age. So nowadays, there's just so much knowledge one person really can't keep up. So it's nice to have that collegiate come together, look together under the microscope. Yes, there's still a library full of books. There's nothing that really substitutes, to me, the handling of a book, and pathology is extraordinarily visual. So you're looking through a microscope, but you're also, our textbooks are, I used to complain in training, are very expensive because there's numerous colored pictures in which to study. And one lung cancer may have 150. Well, there's books on lung cancer, just one book. But yes, definitely the computer has replaced a lot of that. And with COVID and not being able to travel and go to meetings to up your educational exposure. Every year we're doing that online and we're Zooming too and doing a lot of things that normally would be done in person on the computer.
So that's a great segue to the pathologist role in COVID. From the hospital standpoint, we were very familiar with talking to consumers about testing and how rapidly we could do testing and how quickly we could result testing. Tell us about the role of pathology in not only the oversight of testing, but the role in testing the blood and samples.
So COVID testing falls under the laboratory, which is clinical pathology. So that falls under the pathologist overview. So when we first started searching out for the machines like the BioFire and the Roche and the Cepheid to acquire for this hospital, pathologists were intimately involved in that investigation, in the comparison and analysis of different types of machines and testing which ones had the most sensitivity or were the most capable of being right and the most specificity, also capable of identifying the virus if you have the virus. We certainly are very fortunate to have a PhD lab supervisor, Dr. Emily Ryan, and I can't underestimate her role because she has a background in molecular diagnostics and meaning DNA level tests, and the COVID testing is DNA level. And so she was certainly invaluable in that acquisition of the correct test, getting the turnaround time. Certainly getting the materials were very difficult as the nation ran out of, even the individual parts, plastics and parts that made up the machines and the testing kits. But we were able to set up that molecular lab and get those tests and get the testing going. And yes, that was all under the auspices of clinical pathology. Certainly not just pathologists, though. Numerous other dedicated lab people, including members of the Department of Microbiology and Dr. Ryan.
What do you think COVID has done in terms of the acceleration of pathology around, to your point, turnaround time, the business of how pathology was accelerated through that, similar to how vaccines were created in an accelerated way? Do you feel like the pandemic pushed the envelope around some technologies for pathology, clinical pathology?
Definitely. From the Food and Drug Administration to putting out, normally things take quite a while to get pushed through the FDA. And the FDA, established a much faster way of approving temporarily or giving the emergency pass, if you will, to getting these machines up and running. There is no way we could have built a molecular lab like we did here at this hospital if we weren't under the pandemic conditions. I mean, it's unheard of. The space was allocated, the space was built out, because a molecular lab requires certain levels of cleanliness and airflow requirements so that there's no contamination of DNA from the air and from, you have to be very clean, and it has to be separated from all other aspects of testing. And these machines are very large. And we were able to get those so quickly, I think by spreading the right, getting the right people involved with the right education, and everybody being on the same page as far as the importance of acquiring this testing for our population.
What do you feel like is the pathology role now that we're looking at antibodies and antigens, and I'm sure that that's also blood that's being examined on the blood sampling side of what you manage? Is that also something that has been done differently? I mean, is it on a different scale than it ever was? Just the ability to turn results around antibody testing, and for lots of different reasons, I guess.
Yes, it's all kind of caught up in the same thing, and I think now we realize that we don't need to get behind the 8 ball. I think there is a tremendous awareness because of the pandemic of how quickly things can get out of control, how quickly the virus spread, and how quickly our hospitals were inundated with patients that needed the appropriate diagnosis and care right here in our facility. And I think there is definitely a strong emphasis, and appropriately so, of preparing for the next aspect of managing this pandemic, which is the antibody testing, making sure, are you resistant after the vaccine? What is your antibody status and your resistance status? Those are the next, thinking the next step down the road, which is extremely important for managing the pandemic.
Well, thank you very much for telling us so much about your practice.
You're welcome.
Thank you. And thank you for joining us at Atrium Health Navicent Knows Health. If you'd like to know more about Dr. Wright and her practice, you can visit us at atriumhealthnavicent.org.